Hey, welcome to episode 5 of the Nutrible MD Podcast. I'm your host, Dr. Brandon Lip. If you are seeking wellness, happiness, and balance in your life, you are in the right place because all of the original content is designed to expand your horizons in an unconventional way. I incorporate all my clinical knowledge from my father's 50 plus years of experience and my own 25 plus years of helping people with various needs. This is part 3 of Sensitization, Predisposes After Effects. We are going to wrap up by discussing long COVID from a traditional Chinese medicine perspective, go through some quick learning points, and then my final thoughts regarding how infections cause changes in our bodies even long after the original attacks took place. I am sure you will continue to learn a lot from all of my experiences. Let's begin. Long COVID. Over 65 million individuals around the world are believed to have long COVID. It is defined as the persistence of symptoms for at least 2 months after the infection. The disorder has been associated with over 200 symptoms affecting every organ system in the body. Anyone who gets an acute COVID infection can develop prolonged symptoms independent of the severity of the primary episode, although more severe disease appears to convey a higher risk than milder disease. Long COVID affects persons of all ages, including children. Risk factors appear to include the female sex, type 2 diabetes, connective tissue disorders, allergies, chronic hives, and even underlying attention deficit disorder. Those from lower socioeconomic strata and persons with an inability to rest in the early weeks after the infection also appear to be at increased risk. As many as 1/3 of patients with long COVID have no identifiable risk factors from a conventional medicine standpoint. If you don't feel completely back to baseline at least 2 months out from the infection, you most likely have some degree of long COVID. Of all the various symptoms possible, the most disabling of these are the neurologic symptoms resembling myalgic encephalitis / chronic fatigue syndrome. This is defined as a significant impairment in the ability to engage in pre-illness levels of activity for at least 6 months. What is the underlying pathophysiology of long COVID? There are at least a few known mechanisms. Immune dysregulation is one of the major ones, when the immune system has been thrown off and now under less control by various genes and related hormonal feedback mechanisms. I believe that the production of autoantibodies and the havoc they cause are responsible for the vast majority of long COVID cases. We have also seen some evidence of viral reactivation, such as with the Epstein-Barr virus and the human herpes virus 6. Some cases even showed the persistence of the COVID-19 virus, with the viral particles having been identified in the tissues impacted, suggesting that a persistent viral reservoir may be present. Another mechanism involves the blood vessels. Endothelial dysfunction and inflammation are seen in patients with cardiovascular involvement and also in those with the blood clotting too easily. This will increase the risk of deep vein thrombosis and pulmonary embolism, both of which could be deadly. Disturbance of the intestinal microbiome is also involved behind the scenes in long COVID. The collection of microorganisms that live in the digestive tract needs to be in a good balance. Otherwise, our immune system is altered and toxins produced by the disproportionate growth of pathogens in our gut will reduce the ability to absorb nutrients. Even worse, our ability to get rid of metabolic waste is also reduced. I see here another vicious cycle. The toxins produced by an incompatible microbiome makes us retain more harmful metabolic waste, which then in turn increases the levels of more toxins in the body. Now, we are going to move on to the subject of using antiviral medications for COVID. Even with my extensive experience, I have to say that during the pandemic and even its aftermath at this point, there is still a lot of controversy regarding the use of antiviral medications. The most current up to date information as of January 2024 is that Paxlovid is first line and that molnupiravir is less effective in clearing the virus. Now, who to prescribe the Paxlovid to flip flops back and forth. Even up to last year, it was thought that Paxlovid should be given to most patients, whether high risk or not, because it can reduce the chances of long COVID. Right now, that is being contested, and I'm sure the data will keep coming to argue one way or another. There is concern for the Paxlovid Rebound Syndrome, and some argue that it is significant and should be considered as a reason to avoid prescribing it to those with low risk. However, there is also a substantial number of researchers and healthcare providers saying that the rebound syndrome is overrated and that using Paxlovid to reduce any long term effects outweighs the risk. My personal preference is to use an individualized approach. If the patient has chronic medical conditions, the Paxlovid prescription is justified. If the patient is young or middle aged and without pre existing conditions, I would consider the Paxlovid prescription if there are unhealthy lifestyle concerns. This would include substantial alcohol consumption, not enough rest, lack of exercise, social isolation, and poor eating habits. The customized approach lowers overuse of Paxlovid but allows the medication to benefit those with an immune system that could be compromised to some degree. I do want to take this opportunity here to spell out some facts and myths about Paxlovid. First, contrary to popular belief, it does not significantly reduce symptoms during the acute infection. If you did experience feeling better with the symptoms easing up, it was the placebo effect. It does not make you feel better faster. It does, however, reduce your risk for hospitalization or death from a COVID infection. These benefits are seen in patients who are unvaccinated, vaccinated, and boosted, as well as in patients with their first infections or reinfections. Let's finish up the lecture series and today's episode by going through 3 final thoughts. Point number 1. I want to emphasize that viral infections cause changes in the human body during the infection and even after the resolution of symptoms. Often, the immune system's sensitivity is altered and quote unquote remembered for varying lengths of time depending on the interaction between one's genes and the environment. These after effects can have significant changes to one's health. It is very likely that many autoimmune diseases exist because of such causality. Point number 2. Traditional Chinese medicine emphasizes that many factors increase or decrease the significance of these after effects. Those that increase include consuming yin-enhancing substances, stress, poor sleep, overexertion, alcohol, and smoking. Those that decrease include relative rest, appropriate hydration, elimination of unhealthy lifestyle habits, and consuming antioxidants and substances with detoxification properties. We have revealed before in another episode that there is a vulnerable time period during the infection and right after an infection equaling to at least 2 to 3 weeks. What you do during the infection and afterwards have significant consequences. Sometimes the effects are immediate and obvious, but often they are subtle and delayed. For example, COVID infection is known to increase the risk of diabetes. A key concept I have learned and developed further is that consumption of yin enhancing substances during this vulnerable period is often responsible for the development of negative health consequences. Point number 3, detox before you fortify. These 4 words together carry tremendous weight and significance. Here's a car analogy. If you want your car's paint finish to look nice and shiny, you would first wash the car and then follow that up with a thorough wax job, right? If you wax the car directly without washing it, you will very likely scratch up the paint finish. Washing the car is analogous to using detoxification methods, including the use of antioxidants and anti-inflammatory herbs. Waxing and polishing are analogous to consuming fortifying supplements and using yin or qi enhancing herbs. Here are some yin enhancing foods, for example: chicken, lamb, sea cucumber, scallops, squab, snake, oysters, venison, rabbit, honey, and azuki beans. Qi enhancing substances include ginseng and astragalus. Yin fortifying herbs include dongguai, goji berries, sanya, makdong, and bahap. Ignoring this critical rule of thumb will have disastrous consequences. For example, if someone consumes chicken soup during an infectious mononucleosis infection, the chances for multiple sclerosis to appear years down the road is actually much higher. I strongly believe that ignoring this rule of thumb is often the hidden cause behind why certain illnesses seem to appear out of nowhere. So, what can you do to stay out of trouble? The best approach is to eat bland and avoid the use of fortifying herbs and supplements when you're sick. And this extends even 2 weeks beyond when you actually feel like you recovered. This concludes the entire Sensitization Predisposes After Effects lecture series. I invite you to step out of the box and look at all aspects in your daily life never addressed before, because the answer you've been searching for could literally be right in front of you. With what you learn from my podcasts, you will develop the knowledge and the courage to face those health dilemmas and be the best version of you. Please subscribe and let me know what you would like to learn about, and I will do my best to provide you with the most practical and original content from all my experiences. Know that faith and fate are powerful, but you choose your destiny. Until next time.